The Scottish experience. Just to talk about this because it's so relevant to what's happening here in Ireland. The conflict that's happening at international level in relation to how we use pricing mechanisms to reduce the prevalence of alcohol-related problems, it's really exemplified well in relation to what the Scots have tried to do. And in 2012, the Scottish Parliament, they enacted minimum unit pricing. There are various ways in which you can look at how you can use these mechanisms to reduce the consumption of alcohol and the scale of the problems. One is you can, in a general way, just decrease alcohol taxes. The second one you could, as you know, could be done here, we could get rid of something like the low-cost selling of alcohol. But internationally, most of the work has been done on this idea that, and the influence we've had come from Sheffield University Research Group, minimum unit pricing. You set a floor price for alcohol, so that stops the purchase of really, really cheap alcohol. The Scots legislature for that in 2012. The drinks industry reacted very badly to this, and they argued that minimum unit pricing was contrary to EU trade regulations. The case was fought through the Scottish courts, and when the drinks industry didn't win at that level, they took it to Europe. So it's gone to the European Court of Justice, and just, I think 3 weeks ago, we had the preliminary ruling by the Advocate General. Now the preliminary ruling, I don't know if there's anyone here that's tried to read it. I'd say if you have a legal background, it might be still difficult. For me, it was like swimming through treacle. And it had a lot of the Oracle of Delphi touch to it. The Oracle of Delphi was this sort of prophet, and all of the utterances from the Oracle of Delphi were so vague that people interpreted it any way they wanted. After the Advocate General's preliminary ruling was issued 3 weeks ago, both sides declared victory. So it is confusing. We won't have the full ruling until, I think, probably around Christmas. But the Advocate General appeared to be saying, yes, that governments can introduce minimum unit pricing. It's justifiable if it can be convincingly demonstrated that this is a proportional response, because it does interfere with normal trade regulations. One of the other important things that's contained in the Advocate General's ruling is that this should be an issue for national government, not for EU. So that if it does mean that an Irish government could decide to introduce minimum unit pricing. Okay, just briefly, how we run government also has a bearing on what we do with alcohol. Government is sectorised. By this we mean that in Western-style democracies, governments traditionally run their affairs on the basis of sectorised basis. Ministers allocated responsibilities, so you're familiar with this. You have Minister for Finance, Minister for Employment, Minister for Health, Minister for Agriculture, and so on. So critics would describe that a lot of the time as silo management, that you have all of these separate areas of government and that they don't necessarily all work together, they're not always well integrated. And the phrases that have been used, referred to, particularly favoured by New Labour back in the Tony Blair days, we don't have any joined up thinking. They attempt to get through this, to have joined up government. We used to call it here cross-cutting management, and this was popular through the 90s and into the beginning of the new millennium. SMI, the Strategic Management Initiative. It's relevant to alcohol policy is simply that if you were to have an integrated national alcohol policy and one that was based on public health principles, then this really would demand that all other sectors of government will subordinate their own interests to the health interest. In other words, those sections of government that are primarily interested in revenue, for instance, Revenue Commission, the Department of Finance, that they would say, look, I know that we're going to have to forego opportunities to raise a lot of money because public health is more important. Or that those sections of government interested in employment say, I know this might damage the industry and means we're going to lose some jobs, But that's a small price to pay because we're going to have a healthier, presumably happier population. Or those sections that are using alcohol as a central feature of promoting Ireland as a tourist destination. Say, no, well, we might lose a few tourists, you know. Stereotypically, they're going to be stag parties in Birmingham or something who are coming to get drunk for a week in Ireland. But we let that go. Reality is the government doesn't work like that, and we don't have any permanent kind of cross-cutting structures in the main, and all that SMI stuff, just like it happened internationally under the new public management, it's gone. So the critics, you know, people from a business management point of view, are always very dismissive of this. But that is the nature of public sector government, that you have conflicting value systems, and in many ways the silo system is there, it's intact, and it doesn't look like it's going to go away quickly. Now in Ireland, this public health perspective has been promoted and articulated by researchers, by clinicians, for at least 30 years, I'd say. We have had, and I'm not going into the detail because it's too tortuous, we've had numerous policy documents making these recommendations. Government response to all of this has been ambiguous because it's very confusing. I'm involved with a few people at the moment who are doing a comparative study of alcohol policy in Ireland, England, Scotland and Denmark, and it's interesting to see how governments respond. The Scottish one is interesting because the Scots have a very strong sense now that they're running their own show and they can do this, and they're doing it. The Danes are quite entertaining, that they really don't want to make a fuss about alcohol at all. The English are quite honest in the sense that they are clear, we're not going to do this, we're not going to have public health alcohol policies. Irish governments of all parties, there doesn't seem to be any difference between any of them, have been always very respectful. So when a public health policy document is produced, it's often launched, it is nominally at least official policy, it's just that nothing is ever done about it. I've had English people, English academics telling me how wonderful our Irish policy is. I say, no, it's not. It's all, we've some beautiful policy documents, works of art, but we don't really have the implementation. National Alcohol Policy Ireland, I've just given you as one reference. That was the National Alcohol Policy document published in 1996. It was a very good document. It summarised all of the data. It predicted that if the Irish economy continued to do well, which it did, if we had more disposable income, that Irish people were going to drink more, and that we were going to have an awful lot more problems. It recommended using pricing regulation and restrictions on access and availability. And that document was launched by, it was the Rainbow Coalition at the time. It was launched and then forgotten about. And none of the recommendations were ever implemented. And predictably, we had, all through the counter-tiger years, we had a huge increase in consumption and a huge increase in problems. Because the licensing legislation became more liberal, people had more opportunities to purchase alcohol, and they had the opportunity to purchase alcohol at a cheaper price. So where are we now? The Public Health Alcohol Bill 2050, it's kind of the story so far. This is just, in some ways, the most recent episode in the saga of public health and alcohol in Ireland. A very significant, or seemed significant, announcement was made in early 2009. And that was that alcohol was going to be included in the remit of the country's national drug strategy. The national drug strategy prior to that, of course, only dealt with illicit drugs. A steering group was appointed in the Department of Health to advise on the practicalities, how alcohol might be integrated into the national drug strategy. They used all the kind of management phrases. They were going to look at synergies. I believe myself that given the number of previous research reports we had and the number of policy documents we had, that if there was absolute, unequivocal government commitment to having alcohol managed within the national drug strategy, all you need to do is put a couple of civil servants into a room for a month and it could all have been done. The group was asked to started work at the end of 2009. They were asked to report by October 2010. They didn't, in fact, report until February 2012.